My name is Maria Abdurrahman, DB1650121 from the Fire Prof. And today my presentation is about the drug Dapsone, its rational and irrational use. So first, start from the introduction. That Dapsone is basically a sulfone antibacterial and antibacterial agent that it is used to treat the bacterial infections, either to inhibit the bacterial growth or to suppress them completely. It belongs to the bacteriostatic group, means that it is inhibiting the growth or the reproduction of bacteria instead of killing them. It actually suppress the or inhibit the growth of the bacteria. Then it is also a leprostatic agent, that is, it is used to treat the leprosy. So it is mainly kill the bacteria which is causing the leprosy, and usually it is used in not is used alone, but used in the combination with the rifampicin and clofazimine. So these three drugs are collectively used to treat the leprosy. And it is also an anti-inflammatory agent because it inhibits the enzyme known as myeloperoxidase, and this enzyme basically converts the hydrogen peroxide into hypochlorous acid, or which is generated by the neutrophils and cause the tissue damage and the inflammation. So if the enzyme is inhibited, then this whole process of the inflammation and tissue damage is stopped. Then it is also act as an anti-protozoal agent, that is used to treat the protozoa and some protozoa infections. And on the basis of the mechanism of action, if we discuss it, then it is a dihydroxyapatite synthetase inhibitor, means it can act as a competitive inhibitor of the enzyme, which is known as the dihydroxyapatite synthase. This enzyme basically catalyzes the conversion of the PABA into dihydroxyapatite, which is a key step in the folate synthesis. So, if the folic acid is not synthesized, then the nucleic acids are not formed, or nucleotides are not formed, due to which the proper as a nucleoside are building blocks of the DNA and RNA. So, in its absence, the cells are unable to divide. So sulfonamide antibacterials, means this dapsone is used to act as a bacteriostatic rather than the bactericidal effect. Indications. The dapsone is primarily indicated in the conditions like the leprosy and dermatitis herpetiformis, means as it is used as a first line of medication for these two diseases. Number one is leprosy. Leprosy is the chronic progressive bacterial infection which is caused by the bacterium Mycobacterium leprae. And usually there are three types of leprosy. So all of these can be treated by this medication, either used in alone or in the combinations. And usually in the leprosy, we have a severe disfiguring skin sores and nerve damage in the arms, legs, and the skin areas around the body. And the dermatitis herpetiformis is basically a rare but persistent immunobolus disease that has been linked to the celiac disease. It is a means it is characterized by the intensely itching blisters which are filled with a watery fluid. So these two basically can be treated by this along. Beside this, secondary medication for the malaria prophylaxis, pneumocystis pneumonia, and toxoplasmosis. Or it can also be used as adjunctive therapy in these conditions. Basic adjunctive therapy is the therapy which we are given to uh, along with the main treatment in order to maximize the effectiveness of the drug. So these in these four conditions is metastatic germ cell cancer, rheumatoid arthritis, squamous cell carcinoma, and the cutaneous leishmaniasis. We can also give the dapsone to minimize the disease symptoms. Contraindications. It is contraindicated in the following conditions. Number one is the anemia, because if the person is anemic, already anemic, and if we give dapsone to him, then it will dapsone metabolites such as methemoglobinemia, sulfhemoglobinemia, these all are can decrease the oxygen carrying capacity of the blood. So if the person is already anemic, and this then oxygen carrying capacity of the blood is also decreased due to these metabolites, so that it will these cause serious problems. Similarly, in G6P deficiency, it is glucose 6 phosphate dehydrogenase. If is deficient in the person, then we should not give this to him. The porphyria or the HIV infections or liver impairments, all these are the liver diseases. So if a person is liver compromised patient, then should not give these drugs to him. Or sulfone allergy, as it belongs to the sulfone group of the antibiotics. So if a person has allergy to sulfur, then we should not give this drug to him. And also the last one is the cardiac diseases. If a person is suffering from the cardiac diseases, then this drug is also contraindicated in this condition. Side effects are the methemoglobinemia, selfhemoglobinemia, peripheral neuropathy, psychosis, depression, nephrotic syndrome, anemia, granulocytosis, severe hemolytic anemia, and Dapsone syndromes. Actually, these all are the blood disorders related to the blood, or as their oxygen carrying capacity is decreased, and if we use this drug, and or Dapsone syndrome is the condition in which the hypersensitive reactions occur in some patients due to using of the drug. So if we um, but means if we adjust the dose and have a proper check on the condition on the patient's condition when he is using the medicine, so this condition can be avoided. Or if the reaction is shown and a hypersensitive reaction occur in the patient, then we have to replace the drug with other drugs and we have to withdraw this drug. Drug interactions. Dapsone is known to be interact with the 190 drugs, and out of which 10 are the major drug reactions, 178 are moderate, and 2 are the minor. So in 10 major, we have to discuss all 6 here: the cimetidine, clofazimine, trimethoprim, pyrimethamine, rifampicin, and didanosine. So these are the drugs, major drugs which can Dapsone can interact with them. Clofazimine, Dapsone may interfere with some anti-inflammatory effects of this drug in the patients which have the ENR reactions, and higher the clofazimine dose may be needed to control this interaction. Then number two is trimethamine, the trimethoprim. It can increase the dapsone concentrations and increase risk which is associated with the dapsone adverse effects. Means if dapsone concentration is increased if we used this drug with it, and it can also increase the risk of the adverse effects like methemoglobinemia, sulfone allergy, etc. So we have to monitor the drug dose particularly to avoid the toxicity. Then we have pyrimethamine. In this condition, the adverse hematological effects are increased. That is, the blood-related diseases or the adverse effects may be produced. So we have to monitor the more frequently in this case than the usual. Then the danosine, it is usually possible decreased in this GI absorption. Means if we give this drug with danosine, then there is a decrease in the DI absorption of the dapsone, so its efficacy is also decreased in this case. So we have to suggest that dapsone can be given means dapsone and danosine can be given with a time of 2 hours so that they cannot interact and perform their action. Warnings and precautions. It should be used cautiously in the pregnancy, and because it belongs to the pregnancy category C drug. So, however, no any increased risk of the fetal abnormalities can be observed, but it is better to avoid the drug and should not be recommended during the lactation because dapsone is excreted in the human milk. Means if so if we use during lactation, then maybe a chance of transferring this because the hemolytic reactions are usually reported in the nucleus if we use this drug during lactation period. So should be used with the cautions, and also should be used in caution with the patients like the pre-existing blood disorders, liver diseases, kidney diseases, glucose 6-phosphate dehydrogenase deficiency patient, and allergies like sulfone allergy especially. are the doses, different diseases in which we can give the dose. So leprosy, lepromatous dose should be, adult dose should be 50 to 100 milligram per day, and pediatric dose is to 10 milligram per day. Duration is 2 to 5 years. There is a proper course for that. Then leprosy, tuberculite, we give adult dose is to 100 milligram per day. Pediatric dose is not suggested, and the duration is about 6 months. Then herpetiformis, we used 50 to 300 milligram per day, and pediatric dose is not available, and duration is a lifelong base. Then pneumocystis pneumonia prophylaxis, which is that's not suggested for this as second line of medications. In this case, we used 100 milligram per day. Pediatric dose should be 2 milligram per kg per day, and for 14 to 21 days. Dosage form available are the two oral. We can give this drug as orally or transdermally, but in Pakistan we usually used it as oral, and it is available in two forms, that is tablet of 50 milligram and 100 milligram. Or if we talk about transdermally, then there is a gel which is the Axona gel 5%. Brands in the Pakistan. So in Pakistan, the three alternative brands we should prefer for this Dapsone drugs are the Dapsone, available in tablet forms. Packing is 1 to 10, and its strength is 25 milligram. Or price is about 10. And manufacturing is the Biogen Pharma. Then it's available in the 100 milligram strength, with the same manufacturing. It is Biogen Pharma. And the other trade name is the Dermosone, and the tablet 500 is also in the strength of the 100 milligram, and but it's manufactured by the Wilson Pharma. So usually the brands which are used in Pakistan are these two, in the strength of 25 milligram and 100 milligram. And the transdermally Dapsone is not used in Pakistan. However, overseas it can be used. Toxicity and Antidote. So here, the toxic effects of the Dapsone are basically caused by its metabolites, which are oxidized by the cytochrome 250 liver enzyme, and these metabolites are actually causing the methemoglobinemia, self-hemoglobinemia, and hence body hemolytic anemia, which all of these can decrease the oxygen carrying capacity of the blood. So, which will cause the problems. And if we talk about the dose, that normal dose is about 50 to 100 milligram per day, therapeutic dose of the. So, and if we give more than this, so it may be lethal or toxic, or usually the 1.4 gram or greater. If we if a patient consume this, then it may cause death or may a chance of recovery. If we give the antidote, or proper treatment is given after the ingestion. The symptoms which are associated with the Dapsone toxicity are the vomiting, cyanosis, tachypnea, tachycardia, altered and depressed mental status, and the seizures. So, if, in the case of toxicity, if the antidote is given, then it should be patient's life can be saved. So most effective antidote we use is the methylene blue. But if it is not available, then ascorbic acid or the hyperbaric oxygen as alternative we can be given, because there is a if a very high amount of dose is given, then the oxygen basic main problem is with the oxygen, that oxygen carrying capacity of the blood is decreased. So if we give the oxygen, then it can also be cured, while ascorbic acid can also be given as a alternative. Irrational use and alternative choices. So the irrational use, when we misuse the drug basically. So it can be referred that drug should not be used or to the pregnant mothers, cardiac disease, having a person having a cardiac disease, or the hypertensive patients, or the neonates, because then it will cause the problems, as we mentioned earlier, that it belongs to the pregnancy C category drugs and may produce during the lactation, so should be avoided. And if a dose is missed, as we can if you miss any dose, then it should not be like that we can take the when we want it. So we have to take the proper suggestions about that, and we can be skip the dose, or we have to go normal dosing is casual, means don't need to double the dose, or if we skip those, then we eat then we take next time two doses. These all can be included in irrational use, which should be avoided. Or irrational use occur due to the overdosing of some, which may lead to the severe symptoms like the nausea, vomiting, abdominal pain, methemoglobinemia, severe hemolytic anemia, and coma, etc. So we have to seek a medical attention if an overdose is suspected. So should be used according to a prescription, and don't if the drug is not tolerated, then shift the patient to other drugs such as rifampicin. Means if he showed any symptoms which are not good, or he have any hypersensitive reactions, there is a Dapsone syndrome, etc. So we have to don't need to give the drug to the patient. We have to shift to the alternatives and or used in the low doses. For example, such as rifampicin and clofazimine are the drugs which can also anti-nephrotic agent, but these can no, and they cannot produce the methemoglobinemia or the hemolytic anemia. So that is why we can use this as an alternative because they have a less gastrointestinal discomforts or also very effective drugs. So we can use them alone or in the combination usually, but these three drugs are usually used in the combinations in order to treat the leprosy. But in other diseases like dermatitis herpetiformis, we can give dapsone alone if a person can tolerate this. There's a crazy study. A 35-year-old single woman had presented to the outpatient department with a long-standing history of the worsening macular papular rashes with associated development of the hyper and hypopigmented skin lesions for over 2 years. Since the first presentation, she was managed as a case of the chronic dermatosis, which infected skin ulcers under investigation and was covered on systemic short course of the antibiotics and advised on daily wound care. Now she reported worsening skin lesions, estering of the macular papular rashes, hardening of the skin, facial changes, disfigurement, worsening of the skin, ulcers, especially on the legs, which were discharging chalky watery fluid, malaise, and occasional fever. So subjective, we conclude from that a major complaint of the patient is the skin lesion, rashes, facial changes, disfigurement, worsening of the skin ulcers, especially on the legs. Age is 35 years old, gender female, history hyper and hypopigmented skin lesions for over 2 years. Managed as a case of the chronic dermatosis with infected skin ulcers. Means it is not known to be leprosy at that stage. Um, they managed this disease as a condition of the chronic dermatosis, not the leprosy. Medications are the short antibiotic courses and the daily wound care preferred to them. Objective: these are the patient's complete blood count report and the biochemistry. These level others are the syphilis RPR test, which is non-reactive, malaria negative slides. All the investigations or all the lab reports of the patients are within the normal range. So assessment on the basis of all the subjective and objective and the patient's conditions, we can assess that the skin biopsy scraping revealed the positive Mycobacterium leprae of over 10 per high power field from the nose, both ears, hands, and leg under Z. Nelson. So when the skin biopsy is performed, then it is found to be the Mycobacterium leprae with the test of this. So sample are taken from the nose, ears, hands, and legs. So the patient is managed as a lepromatous leprosy. Now we are confirmed that this case is not dermatosis but of the lepromatous leprosy, which is based on the clinical picture and positive laboratory findings, and was initiated on the multi-drug therapy. So it was found to be the case of the leprosy, then we have to start the multi-drug therapy as per the protocols. So plan of as I mentioned earlier, that there are usually three drugs which are used to treat. In multiple therapy, the three drugs can be used in combination. So the first one is the clofazimine, which is 300 milligram once a day. Rifampicin is 100 milligram once a day, and Dapsone 100 milligram once a day for an air with casual reviews. Means if a person cannot show any Dapsone syndrome or hypersensitivity reactions or not cell phone allergy, then we have to continue the treatment for the air. Also, the patient has to do daily wound care, that is skin ulcers on the leg are present. So we have to take care of the wounds. And along with this, we have to take the pyridoxine, multivitamins, and vitamin B complex supplements in order to provide strength. Now the but we have to take proper notes that for the body hard scared lesions, that is disfigurement of the skin which is produced hyperpigmented hypopigmented conditions, we cannot do anything for this because so she has to bear with this mummified skin with the hope that it may soften with the time. Yeah, it can be cured, but we cannot do anything for like that now. So social worker and psychologist may incorporate to address her the psychosocial needs. So a proper patient counseling should be needed in order to make her uh, may her understand that she has to bear with this skin, with this type of the skin. Now the reference the end. Thank you.